Hello and welcome everybody. We're back from the Society of Healthcare Innovation. With me is Brian Kearns, and we have a guest today, Laurence Girard. Hi, Laurence.
Hi, thanks for having me.
Sure. Welcome. And the reason why we thought we should talk to you today is because we wanted to get a sense of what your healthcare ventures are. As you know, our talk is all about financing innovation in the field of healthcare, and you made quite a space for yourself. And we thought this would be a nice opportunity to listen to your thoughts and tell us how you've come to the successful point where you are right now. Brian, should we start with just asking Lawrence about a little bit of a background on himself?
Sure, that sounds great. You might as well introduce yourself, let our viewers get a little understanding of where you're coming from, and then a little bit about what you've been doing at Fruit Street.
Sure. Well, I was originally on the path to going to medical school, and then when I was an undergrad, I was volunteering in a emergency room while taking a nutrition epidemiology course with a Harvard School of Public Health professor, and I realized that a lot of the patients that were coming into the emergency room with diabetes, heart disease, stroke, obesity, that a lot of it was preventable through diet and lifestyle. So I became very interested in public health. And then I learned about entrepreneurship when Harvard opened the Harvard Innovation Lab on the business school campus, which is where serial entrepreneurs come in and teach and mentor the students. And that's where I got interested in entrepreneurship and basically started Fruit Street as a summer project at the Harvard Innovation Lab, had some physicians from the medical school invest, and a summer project turned into me just changing my whole career path from becoming a physician into becoming more of a technology and public health entrepreneur.
How many years do you think went by before you came to a proper final project that you think would make you a successful venture capitalist or innovator?
Well, I think it's more of like a lifelong long learning concept, just like
That's
with
right.
with a physician. You're never done learning as an entrepreneur. I think startups are often companies that don't know what its product is or who its customers are. So our original business model for Fruit Street was actually licensing telemedicine software to healthcare practices so they could
Mm,
do telemedicine with their patients. After 4 years of software development and millions of dollars spent, we realized that was the completely wrong business model, and that we should actually take that software and delivered telemedicine services to self-insured employers and health plans. We started with the diabetes prevention program, now getting into urgent care and mental health. But it's funny how our original, product and business model is not generating any revenue now. It's completely different. And so I think that's not an uncommon story for startups. It takes a long time to find product market fit and discover what that scalable business model is.
wonderful. And how important do you think all that advice you got from physicians and experts and MBAs was initially?
I think critical, especially because of the age that I was when I started the company. But
Hmm.
really, for any entrepreneur, regardless of age, I mean, it's always good to have people that are experienced around you who can also disagree with you and challenge your thoughts. But I think that we like the physician funding model in particular because the physicians are focused on having a social impact, but they also have experience with real patients. And some of them would actually use our product in their practice. And so our investors were actually our customers and our users in the beginning of the company. And that advice was very valuable in terms of improving our products, which is something that a venture capitalist sitting in spreadsheets wouldn't be able to help us with.
It seems to me like you had an entrepreneurial mindset and you just figured it out over time. Some other folks may not have that quite same inclination, but they nevertheless may have a great idea. What are the first steps you'd recommend they take to take an idea towards fruition?
I think that you need to get market validation that people are willing to pay for the product, and don't ask your friends and family what they think of the idea, because they're going to tell you they think it's a good idea because they're not going to want to hurt your feelings, right? So I would say, and I would also say, don't hire engineers to build the product. You can design really just sketches, wireframes of what your digital health idea is and show it to users, but then also talk to customers. For example, if your customer is going to be the hospital, then talk to the hospitals. If it's going to be employers, talk to employers. If it's going to be health plans, talk to health plans before you start raising capital, because you may discover very quickly that um, it's a great idea on paper, but no one's willing to pay for the product. And so I think you need to think very critically about your business model and if your customers are willing to pay for your product before you start investing millions of dollars into software development or you raise capital from investors.
How many other advisors did you feel like you needed to bring on, or do you wish you brought on? You mentioned how in the second go around you brought on the technical expertise, which was very valuable for a software as a service type of company, but maybe more healthcare oriented or less technical might not need that expertise.
Really what you need at the end of the day is I don't want to use the word salesperson, but it's like a chief revenue officer who can test your hypotheses for products against the market. I mean, my company finally took off when I got my first really experienced person that could sell to employers and health plans and bring me on that path to revenue. Because a lot of entrepreneurs make the mistake of spending years building products, but not selling to the right customers. I mean, it should actually be the reverse order in many ways. Talk to the customers first, find out what they want, and then build a product to meet solve their problems. And so I think that was one of the best hires I ever made, that first salesperson to interface with the market and get customer feedback.
I'm going to take a deeper dive, Laurence, into the funding aspect of your venture. Give us an understanding of what your experience was like when you set out on that trip, to meet physician investors.
The first investors I had met at the Harvard Innovation Lab, and getting the first check is always the hardest one. But now it's like, we have 500 physicians as investors, and so it becomes easier. But I think getting that first check can be a bit difficult. And we've been able to use platforms like LinkedIn to reach out to physicians and have them invest. And so I would definitely recommend using LinkedIn as a platform to reach investors. It's a new world now. The days of venture capital are ending.
Does that mean that the days of seed funding and series funding is also sort of coming to a similar conclusion, or you see a modification of that in the future?
I just have to make a provocative statement to get the listeners, interested. But what I mean by that is, I think that the way that healthcare entrepreneurs will raise their seed rounds and even their Series A rounds going forward is going to be from the crowd. It's going to be from individual investors. If you think about a nurse in Detroit that comes up with an idea, why not just have 1,000 nurses invest $1,000 each, which is $1 million, or even have 40 physicians invest $25,000. It's a much easier way to raise your seed round of $1 million than trying to compete with everybody for the Silicon Valley venture capital firm to invest.
Right.
And even doing a Series A of like $5 million, you can now raise up to $5 million through regulation crowdfunding. Venture capital probably still has its place when you get to a certain scale and you need to raise $50 million all at once, and you need to do it in a 3-month period. Okay, granted, most people are not going to be able to raise capital quickly in a $50 million tranche. Right. But I think at the early stages, this is going to become the standard way that people raise money.
And so are there other companies or startups or successful ventures such as your own out there? Is this something that you borrowed, or was this an idea that just really came to you and you ran with it?
I think I was one of the first when the new regulations came out that allowed for advertising investments. But since that time when the Jobs Act passed, there's different crowdfunding portals that have started, like WeFunder, Seed Invest, Start Engine is another one. Mm-hmm. And I'm even starting one, as well, a crowdfunding platform called Healthcare Shares. And I think those platforms have become very popular. They've invested hundreds of millions of dollars into these companies. But I've also seen other companies outside of the crowdfunding platforms running these Facebook and LinkedIn ads in the newsfeed with great success. So I'm definitely not the only one doing it. There's many entrepreneurs that are raising capital this way.
And what is the expectation for these investors? What do they come in thinking? Are they going to hit a jackpot, the first time around, or what should their expectations be, and how should we handle them?
Their expectation should be that they're going to lose all their money. So, but if they're successful, then just like a venture capital firm, right? If the company they invest in and that they buy stock in gets acquired or has an IPO, they could get a big return. It could be 2 times, 3 times, 5 times, 10 times return on investment. And we know that most new ventures fail, but the ones that succeed can have amazing results where there's huge return on investment. But people shouldn't be investing, their kids' college tuition into a startup because it's risky.
Right.
But for certain investors, putting a small percentage of their portfolio into an early stage company can make sense. And then if you see that company grow from being an idea on a napkin to an actual company. I guess you can invest more as it becomes less risky, but you shouldn't invest something you're not willing to lose.
When you say certain investors, I assume you mean accredited investors.
Yeah, well, for a regulation crowdfunding campaign, it can be non-accredited investors as well that could invest $500.
I see.
Right?
I see.
For those types of investors, they're not always investing for financial reasons. They could just be investing $500 because they believe in the product, and it's not a donation, but they think about it as a donation, or maybe they are a customer of the product. So somebody investing a few $100s is one thing, but someone investing 50 or 100 grand in a startup, that can be a significant amount of money.
Talking to you, I'm believing more and more about what you said earlier, but it is a changing economy and changing world in this space. I think those are all the questions that I had. Brian, did you have any concluding statements or questions?
No, that's it. Just wanted to thank you very much for taking the time and explaining your story, and very good overview.
Yeah, thank you for having me. And the last piece of advice is that you can fail multiple times, but the key thing for entrepreneurship is perseverance. But don't persevere in an unintelligent way. Persevere through the magic of a culture of experimentation and the scientific method.
Well, I just hope whatever you said is going to be immensely helpful and motivating to some other young investor out there who's come up with a big idea. So thank you again from all of us here at SHCI, and I hope to speak to you again in the future.
Thanks.
Thanks.